The number of children in London is about 2 million.
It's a very young city, and of those around 10% have asthma.
And that equates to about 3 kids in every classroom across London have asthma.
That's the size of a small town in its own right, just full of children with asthma.
So it is a big problem that we know we can do better on.
I think one of the lines that I've heard recently, which I think is quite important, is people have become confident in managing it, but confidence doesn't necessarily mean competence. And therefore we have become slightly relaxed about how we treat asthma.
I think the problem is that it's so common that people actually don't take it seriously, and they don't think that they need to do anything specific for it, whereas in fact it's been shown that a consistent approach to managing children and young people with asthma will bring about much better outcomes.
We know there's pockets of really good practice across the system, both in primary care and in hospital care, but we also know there's poorer practice. So we know that over 4,000 admissions to hospital are for asthma reasons, and we also know that about 12 deaths a year are from asthma, and we can do better than that.
Compared to our European counterparts, we do very poorly. Unfortunately, we're bottom of the league table. So all other countries within Europe do much better than us, even countries that have less money per capita. The learning from that is actually that we can do more and we can be better at what we're doing with the same resources that we've got. I think we just need to be better at recognising children who have poorly controlled asthma and making sure that we do those simple things.
So what we are doing across our programme is actually making people much more aware of the need for a consistent approach to asthma. So the need to look at children's asthma management plans in primary care, to ensure that they know how to use their inhalers, to ensure that schools know how to manage them, and to ensure that they know how to manage their own asthma and seek help when necessary.
So we're working with providers and staff across London. We're launching a toolkit which helps give practical advice, standards of services, and we're working through commissioning and providing services to make sure that people develop and implement these standards with the support of the programme.
At the moment, what we know is that there are many different tools available and everybody tries to adapt it, and lots of work goes into developing them again and again. The toolkit provides a one-stop shop for everybody, from patients and their parents to healthcare professionals in different areas of healthcare.
So we can measure how many asthma management plans we have. We can audit, like the asthma audit we've been doing through pharmacy, so we can see how we're doing and benchmark ourselves against progress. We can look at admissions to hospital for how many people have been admitted for purely asthma reasons, and that helps us track our progress.
It's going to cover the whole system, from primary care to pharmacies, schools, hospital care, and anyone who works in any of those areas will find something that can really help them to support children and young people with asthma.
It's to reduce variability and it's to improve the standards across our capital.
The main advantage of something like the asthma toolkit is it's going to really help standardise the basic care that all children will get, and that should feed in and reduce the overall number of critically ill children with asthma.
With the asthma toolkit, we will be really grateful and more than happy to help you implement and make sure that this is embedded in every contract, in every provider services that deal with children and young people with asthma.
I would like to see the toolkit used by the 32 CCGs within London. I would like to see this toolkit rolled out of London to the rest of the country. I would like to see less hospital admissions. I would like to see less children on PICU. And I would like to see less coroner's cases where asthma has been the cause of death in a child.
The ambition for asthma care in London is that everyone who has contact with a child or young person with asthma understands their role and delivers it effectively.